And welcome back to HealthWise here on RTV, KDCG Television. We're speaking this evening with Dr. Terry Cromwell, and you're a longtime plastic surgeon from Acadiana Plastic Surgery and Associates on South College. Thanks for being with us this evening, Dr. Cromwell.
Yes, you're very welcome. I'm glad to be here.
Well, there are so many people out there that have questions or are thinking about plastic surgery. Is it right for me? And what's involved? And is it scary? Are there risks? Or are there, and I think you're going to answer many of those, maybe put those kind of fears to rest this evening.
Yes, I'd be glad to.
What are some of the, the common questions when people are thinking about plastic surgery? For instance, maybe having, just a small surgery done.
Usually, I think the first thing people want to know is how much downtime there's going to be. Also, what are the risks of surgery, and what the actual surgery entails. In other words, will it have to be done with local anesthesia, or would it be better done with general anesthesia? So they want just all the pieces put together.
We've seen, from my standpoint, a trend in the last decade where plastic surgery used to be, limited to certain things. Now it seems like a whole world has been opened up and possibilities are out there.
Yes, that's very true.
What are some of the things that you work with?
We do plastic surgery, and I would call some of it reconstructive surgery. But starting with children, one of the problems that I like to take care of are children with prominent ears. I see these kids that are teased a lot on school buses and in different venues, and an otoplasty is, once again, right away you have to say, well, what's the downtime, and does it need to be done under general anesthesia? I mean, if you're coming in to see me and you have your 5 or 6 year old child, and then you really want to know, what's involved, because the last thing you want to do is take any risk in having elective surgery.
So these otoplasties, kind of take us through a little bit, briefly, the steps.
Well, the first thing is to, of course, define what the deformity is. And it varies quite a bit in different children and in adults, too. We see a lot of adults who've gotten into their early adulthood, and they've never liked their ears, especially
a lot of people
young ladies like yourself. You have your hair down right now, so but sometimes you'd like to wear maybe a ponytail. So anyway, once you define the abnormality, then you show the patient what needs to be done, and you outline the operative procedure. It usually takes about 2 hours to do an otoplasty, and for adults, it can be done with local anesthesia and some sedation, very, very nicely. For children, they don't want to lay still for 2 hours, so they do have to be put to sleep. So it's a general anesthetic. And the surgery is all done from behind the ear, so there's no scar that's visible. And you can usually get a very nice, natural-looking ear from really almost any kind of ear. Or any kind of a deformity. I've been doing this for a long time, and so of course, I've had quite a bit of practice, but still, it works very well. Now, the downtime, patients have to wear a dressing for, say, almost a week, and then after that dressing comes off, they have to be a little careful as far as like sports, working out, probably 3 weeks before they can go to the gym, and probably 6 weeks before they'll really feel comfortable, like playing tennis or other physical sports where they might get banged or hit on the ear. So that kind of outlines it for an otoplasty.
Dr. Cromwell, it's nice that you brought up, things that you do for children and reconstructive surgeries that you do with children, because a lot of times we say the word plastic surgery and we think of adults and maybe they're aging and they want to look younger, but that's not so all the time.
That's correct, and plastic surgery training, and it goes back to most of our residencies or our training periods, where we did a lot of work with like cleft lips, cleft palates, all kinds of congenital deformities and abnormalities, and even traumatic, like burns, burn reconstruction, grafting. There are also some lesions that, there's something called a giant hairy mole that can be a large black lesion, and I've had a couple of kids come in that the mole covered like their entire forehead.
We've seen this.
And
right.
The problem with that is not only are they unsightly, but also they have a very high risk of melanoma or malignant skin tumors as they grow older. So there are ways now to take those off and get a nice result with grafting and other techniques. But yes, we do a lot besides cosmetic surgery, and yeah, I would like to emphasize that.
Yeah, so many things out there. What is this whole plastic surgery phenomenon? When did it start, and where does it come from?
It really had its start back in the 1930s. After World War I, there were so many badly injured soldiers coming out of that particular war, lost faces and arms, and anyway, and a lot of the plastic surgery initial work was done in England. But the word plastic comes from the Greek word plastikos, which means to mold. And of course, the ancient Greeks were famous for their artwork, their statues and their sculptures, and so plastikos was a natural word for what we do. And
interesting there.
Yeah.
Now you actually have some associates that actually work along with you.
Yes.
Plastic surgery associates.
Right. Dr. Mess, Dr. Henderson, and Dr. Romero, and we all have our little special things that we like to do. And myself, as the years have gone on, I've kind of started doing more cosmetic surgery, like eyelids, blepharoplasties, facelifts. I do a lot of rejuvenation of the face by harvesting fat from liposuction and putting it in your facial lines and things like that.
And that's really interesting. We're going to talk more about that actually when we come back. But right now we've got to take a short break, and you're watching HealthWise. We're speaking with Dr. Terry Cromwell with Plastic Surgery Associates, and we'll be right back after these words from our sponsors.